Plastic surgery and the thoughts that children probably don't pop into your mind when you think about plastic surgery. So you may be surprised to find out that about 300,000 children and teens in our country undergo the knife every single year. Now they do it not to look better than anyone else, but just to fit in. Children can be just downright cruel to one another. Dr. Samuel Stahl is a chief of pediatric surgery at Texas Children's Hospital and has heard just about everything his young patients go through.
You're skinny, you're fat, you're short, you have this, you have a funny face, you have a funny nose, you have big ears, you look like Dumbo. This is not a good thing. And then you're automatically on the out. And socially, that's tough.
Many children have severe deformities that set them apart from the rest, whether it's a cleft palate or large ears.
You cannot look at this child without thinking he's going to take off. That's what he gets from anyone he sees. And it's not like he has long hair to cover it. It's not like it's going to get better or he's going to grow into all these myths.
Doctors say a simple procedure can pin down a child's ears and increase their self-esteem forever. Take a look at the before pictures on the left and the after-surgery pictures on the right of this patient.
To make a child's body part function better or look a little more normal really helps them, I think, socialize and do well in school and do well with their families.
It's not all about facial plastic surgery.
We do everything in one day, from remodeling the skull to doing hand surgery to doing skin grafts on the body.
Children have to want the surgery, and both parents and child must understand the risks.
Plastic surgery has a connotation of being without scars and with no recovery, and you're back home the same day. It's just not that way. Plastic surgery is real surgery, and some of the surgeries are huge surgeries involving a great deal of blood loss, long recovery times, and a lot of post-operative rehabilitation.
Obviously, you would never do anything that could cause them harm. And while there are risks of surgery, the surgeries we're talking about, the facial things like ear surgery, the nose surgery, the skin surgery, is safe. The very low morbidity with a high incidence of very happy patients.
Parents say even though health insurance doesn't cover the cost, reconstructive surgery is usually life-changing surgery. Joining us now this morning on the end there is Dr. Camille Cash. We also have Dr. Franklin Rose, who's a plastic surgeon, both plastic surgeons, and also your patient, Carly Cook. So glad you're all with us this morning. Carly, I want to start with you because you had a life-changing surgery that we were just talking about. What did you have done?
I had a breast lift and reduction.
So how old were you when you underwent that?
I was 21.
At 21, you were sick and tired of all the things that people had to say with you growing up. What were some of the things that people that said to you that made you want to have a reduction?
I think they would call me chesty and big, just a lot of derogatory things that probably are profane.
And so many young ladies want to be larger, but in your case, it was a detriment for you.
It was.
Dr. Rose, do you see a lot of patients come in who have a similar problem, who their entire childhood have been given a very hard time about a body part that they can't even help?
Well, in Carly's case, she's about 2 months post-op. She had surgery 2 months ago. And I think we have a preoperative image here.
We can zoom in on this and show.
She's been able to lose a lot of weight since her surgery. She's had a fabulous result. She related to me that in junior high school and in high school, she was the object of derision and teasing. So many patients will benefit from breast reduction surgery, say 17, 18, 19 years old, if breast growth is fully complete and fully done.
In a situation like this, besides the fact that people ridiculed her, which is so completely unfair for her, does it help medically when a girl has large breasts? Does it help back issues and things like that too, so that it may make them feel better as well?
Oh, sure. Breast reduction surgery in some cases can be insurance reimbursable due to chronic back and neck pain, brassiere strap grooving of the clavicles and of the shoulders. Sometimes the insurance carriers, it gets a little harder these days, but it's a very good operation, not just in terms of appearance, but just in terms of alleviating these symptoms that we just discussed.
Dr. Cash, you've operated on a lot of children and teenagers, and you were telling me about the fact that it does change their lives. What are some of the surgeries that parents might not even know are available for children?
Well, I think it's really also important to understand that not just women or girls have issues with their breasts, but sometimes young men also will have an overgrowth or overdevelopment of their chest area or breast tissue. It's a term called gynecomastia, where boys will have an excessive amount of breast tissue, and that's a concern and an embarrassment for them as well.
And what age group are we talking about where they are a candidate for surgery?
We'd like to see boys that have been affected for a year and a half to 2 years of stable breast growth, and that there's no underlying conditions that might be contributing to that.
Are there any other things that you guys want to talk about, just very, very quickly, other procedures parents might not know about?
I think one thing that is important to talk about is asymmetry to girls' breasts. So you may have a girl that has one breast that's significantly larger than the other one, and so a unilateral breast reduction may be in line for them as well to give them more balance.
Dr. Cash, Dr. Rose, and Carly, thank you for coming in and talk about this important matter. I think it's good for people to know that there are options when people are giving you a hard time. Carly, we're sorry about what you've been through. Hope you feel a lot better now.
Thank you.
All right, we're so glad.